Welcome. My name is Nathan and I am a licensed clinical addiction counselor. In the last video, I talked about relapse prevention and addiction recovery. And in this video, I want to build on that discussion by talking about something that can help you stay on track in recovery over the long term, which is a maintenance plan. Think of a maintenance plan as a roadmap for your recovery. It helps identify what is working, what challenges you might face, and what actions you can take to protect the life you're working so hard to build. Recovery is much more than simply stopping alcohol or drug use. It really is about creating a life that supports your physical health, emotional well-being, relationships, purpose, and personal growth. A maintenance plan can help you do exactly that. All right, so one of the biggest mistakes people make is waiting until they're struggling or facing a crisis to think about recovery planning. In reality, a strong maintenance plan should be developed as early as possible and continually adjusted as your needs and circumstances change. So, some key elements necessary to establish the maintenance plan include number one, assessment of current stage of change. So this might sound like kind of counselor jargon, but I wanted to include it because I think it's important that you're you have a solid understanding of where you're at. And that may sound a little strange, but I see it a lot. People think that they're farther along in the process than where they're really at. So I think it's a good idea to think about it's like, have you really thought about like what change means? Have you contemplated like what that actually looks like? Have you done things like weigh out the pros and cons of, you know, your active substance use versus stopping substance use? Have you done any research as far as like supports that are available, or counselors or treatment centers that can help you, or mental health facilities that you can reach out to, psychiatric providers, all of those things to have you taken any sort of action? And going through that, then if you feel that you've kind of resolved all of those things, then as we're talking about here, what does your maintenance plan look like? So I really think you need to spend some time to really figure out where you're at, because if you don't have a good handle on that, it's going to be very difficult to kind of find your way forward, because you could be working on things that you're not ready to work on, or you're gonna come across things that you're not prepared for because you've not taken the time to do the work to prepare, so on and so forth. So first and foremost, again, you really need to think about assessing your current stage of change. Number two, the second thing would be identification of recovery capital. Recovery capital refers to internal and external resources that support sobriety, such as coping skills, employment, supportive relationships, safe housing, and access to healthcare. Assessing recovery capital helps determine supportive strengths and areas requiring development. Number three, history of relapse and triggers. Understanding past relapse patterns allows you to proactively plan for high-risk situations and emotional states. 4, co-occurring disorders and individual needs. Integrated care is often necessary, since untreated mental health or physical health disorders could easily undermine recovery efforts. Ultimately, establishing these components creates a foundation where you could really have a good place to start from. And ultimately, it allows you to take ownership of your recovery. Once the key elements and foundational information is established, the next step is to begin developing a personalized maintenance plan. No two people are the same, and therefore plans must be uniquely tailored. So the core objectives of maintenance plan development. The area of focus is relapse prevention strategies. An example of the plan components are trigger identification, coping skills, structured scheduling, and emergency plans. The next area of focus would be social support. This would be things like 12-step or SMART recovery participation, peer support services, sober mentoring, family involvement, those types of things. Next area of focus would be mental and physical wellness. The examples of plan components would be things like counseling, medication management, nutrition, exercise. Next area of focus would be lifestyle stabilization. This would include, or examples of plan components for this would be employment support, educational opportunities, and financial planning. Next area of focus would be spiritual or personal meaning. Example of plan components for this would be faith-based support, mindfulness, creative outlets, those types of things. Identifying measurable goals within each of these categories ensures accountability. For example, instead of attend meetings, your goal might state attend 3 AA meetings weekly and obtain a sponsor within 30 days. The idea is, again, to really, well, let me say that differently. If things are too generalized, it makes it really easy to put it off or not do it. Whereas if you can hold yourself accountable to say, well, I'm not just going to go to a meeting at some point. No, I'm going to commit to going to one meeting this week, or as the example stated, I'm going to go to 3 meetings, or I'm really going to work on, finding a sponsor, or, maybe you're curious about, things like meditation, or maybe you're interested in exploring your spirituality. So maybe you make a plan and commit to saying, you know what, I'm going to go maybe spend some time doing some research on, for example, mindfulness techniques, or, I'm going to maybe spend some time looking at, you know, like Buddhist principles or ideas, or maybe I'm going to commit to going to exploring some faith-based organization, like I'm commit to going to a church service over the week or something. But the more specific that we can make it, again, the idea is that there's more accountability, and the more accountability, the more likely that we will end up doing whatever that goal is we set to us, instead of just something that is vague and really not measurable. Implementation represents the transition from planning to active engagement with daily recovery behaviors. During this stage, individuals apply the skills and supports outlined in their plan while continuing clinical and social follow-up. So, number 1, integration into daily life. At this point, you'll commit to practicing consistent structure by building a daily routine that minimizes idle time and incorporates recovery actions such as morning check-ins, scheduled exercise or journaling. Number 2, continued therapeutic support. Depending on your level of need, supports may include weekly outpatient counseling, something like aftercare, for example, peer recovery or peer support services, support groups or community recovery meetings, case management services, medication assisted treatment, MAT, when clinically appropriate. Number 3, monitoring and documentation. I really think that this is something that is really important. You want to be able to track your progress towards goals. Monitoring may include something like urine drug screening for accountability, review of meeting attendance, skill practice check ins, mental health symptom assessments. I would also think, things like journaling would be a good idea, some sort of a daily log or some way to just be able to track and look at, like, on a day-to-day basis what you're doing, maybe keeping track of the things that are working, things that aren't working. Ultimately, implementation is not linear. You may require adjustments in intensity of services over time to reinforce success or respond to setbacks. And I think that that's important. I mean, I see that a lot, for example, in my practice. I mean, we have some clients that, are doing really well, and then they'll maybe step down to, for example, coming to aftercare like maybe once a month, or maybe they've completed aftercare but want to continue to meet with their counselor, so they, do individual sessions, for a while for some ongoing support and accountability. But then on the flip side, we've also had clients that have, maybe been involved in aftercare, have been doing well, and have, something happens, there might be a use, or there might be, some return to some old behaviors or even back to addiction. So then, they come in and we look at moving them into, more intensive services as the situation, or may require. But I mean, I think that it's important to be honest with yourself again, to always kind of going through that assessment and just saying, what are my needs? Where am I at? Do I need more help? Is there something happening where I'm struggling? Maybe I had some real significant lifestyle event, or, change within my lifestyle, or maybe it was a loss of somebody that meant a lot to me. Maybe I lost a job. There's just, life is so up and down, and, life can come at us sometimes and present us with things that we're simply not prepared to deal with. So, if we're going through, and kind of continually monitoring and assessing our needs, it's a lot easier to reach out for help and to, take care of things when they come up, instead of just trying to make ourselves believe that everything is fine and letting ourselves, kind of slide further and further back into old behaviors and farther back into kind of patterns of unhealthiness, which, that's one thing within that relapse process, is the farther we progress through those kind of stages of relapse, the harder it is to get ourselves out of it. So, again, this is a real good way to catch ourselves before things get really out of control. The maintenance plan becomes a living document that you will actively use during your recovery. It's not a static chart filed away after, like, discharge from treatment services, or it's not something that you just, like, all of a sudden one day, well, I got it, I achieved it, file that away or throw it away or whatever, I don't need it anymore. Practical utilization focuses on daily application, empowerment, and ongoing self-awareness. Relapse prevention is both behavioral and cognitive. You'll need to learn to recognize early warning signs such as isolation, irritability, or romanticizing use, applying coping skills, or tools like grounding exercises, contacting a sponsor, or attending emergency meetings. Another thing you'll need to learn is to utilize crisis steps such as calling a recovery hotline or reaching out to a trusted support person. The plan guides you what to do, who to call, and where to go when danger signs appear. Recovery is rarely successful in isolation. Support utilization may involve building sober friendships, engaging family in treatment through family management interventions, involvement in sober recreation and community service. You will also need to continually evaluate whether your relationships are supportive of your goals and make changes as needed. And then the last thing is promoting empowerment and identity shift. A maintenance plan encourages you to view yourself as someone in recovery who contributes meaningfully to their life and to their community. A lot of people discover new identities beyond addiction, which I believe is a critical factor in long-term success. All right, the next thing that I want to talk about is the idea that recovery is dynamic. This requires periodic reassessment that explores number one, changes in stressors, environment, or living situations. Two, progress or setbacks in employment, relationships, health, or mental stability. And three, shifts in personal recovery goals. What works during your first month of recovery may look different than what works after several years of sobriety, and that's okay. Growth is part of the process. The most effective plan remains flexible while keeping core commitments intact. Next, let's talk about some of the most common barriers people face in recovery and some strategies for managing them. This isn't a complete list, and not every barrier will apply to you. Everyone's recovery journey is different. My goal isn't to tell you what your barriers are, but to give you some examples of the challenges people commonly experience in early recovery. And then as you listen, think about which of these might apply to your situation. Identifying potential obstacles before they happen is one of the best ways to prepare for them and strengthen your maintenance plan. Remember, barriers don't have to cause relapse. When you recognize them early and have a plan for how you'll respond, they become much easier to manage. Let's look at some of the most common barriers people encounter in recovery. First barrier would be housing instability. A strategy or strategies for management would be linkage to shelters, sober living homes, transitional housing programs. Next barrier would be poor access to healthcare. Strategies for management would be Medicaid navigation, telehealth services, integrated care. Next barrier would be stigma and shame. The strategies for management would be peer mentorship, self-compassion practices, advocacy, education. Next barrier would be co-occurring mental health symptoms. Strategies for management would be psychiatric referral, psychotropic medication management. Next barrier would be social pressures or exposure to substance use. Strategies for management would be relocation, boundary setting, sober networks. The next barrier would be lack of employment or purpose. Strategies for management would be vocational support, volunteer opportunities, education. Acknowledging barriers increases your preparation, and self-efficacy. It is really easy to not want to ask for help, or even feeling some level of shame because we feel we should have an answer. But the reality is we don't know everything. If we do not know what the problem is, we simply cannot fix it. And if we don't know what the solution to fix the problem is, we need to be able to humble ourselves enough to ask for help. And that would maybe be what I would consider kind of the biggest barrier in recovery, is not asking for help and just feeling like we should just kind of push through it, or trying to convince ourselves everything will be fine, or it's a moment and it will pass, when the reality is that really what we're responsible for is, again, first and foremost, identifying what our barriers are, and then working towards identifying strategies for managing those barriers. And again, if we struggle with either establishing the strategies or even implementing those strategies, that's where we need to have the humility to simply reach out and ask for help. If there's one thing I hope you take away from this video, it's that recovery doesn't happen by accident. Long-term recovery is built through intentional choices, consistent actions, and willingness to ask for help when needed. A maintenance plan gives you a clear path forward when things are going well, and a guide to follow when things become difficult. It helps you stay focused on your goals, strengthen your support system, and continue building a life that supports your recovery. Remember, recovery is not just about avoiding alcohol or drugs. It's about creating a life that feels meaningful, fulfilling, and worth protecting. The work that you're doing today can become a foundation for a healthier and more rewarding future. Thank you.